Good morning. My name is LaDonna Duncan. I am the Human Resources Benefits Assistant Manager. On our Human Resources team, we also have Shyla, Marshall, and Allison. We also have Wendy Johnson, who is our Benefits Coordinator for Health. We're going to go over our employee benefits for open enrollment. The Muscogee Nation does offer several benefits for us. We do have Blue Cross Blue Shield of Oklahoma. For this year's open enrollment, nothing has changed on our Blue Cross. We also have AFLAC, MetLaw, the Bank of Oklahoma, which is your 401k plan. We have donated sick leave, workers' comp, and then Hartford Insurance. Those are the topics that we will cover today. Again, on our Blue Cross, nothing has changed. Our Blue Cross plan, still for employee only, is $15. For employee spouse is $60. Employee child is $60, and employee family is $90 per paycheck. Enrollment requirements for Blue Cross. To add your spouse to Blue Cross, we do need a copy of your marriage certificate or a common law affidavit. Keep in mind, if you add your spouse using a common law affidavit, if you all separate for any reason, we will require a divorce decree to remove the spouse, or you would have to wait until open enrollment to remove that spouse. If you're adding children to your Blue Cross, we do need copies of birth certificates, adoption forms, or guardianship paperwork. And this is even if you are already enrolled in the Blue Cross, we do need these forms. Our deductible for Blue Cross, it's still a zero copay, zero deductible, zero out-of-pocket if you use an in-network provider. If you're using an out-of-network provider, it's 40% copay for employees. The deductible for out-of-network is a $200 deductible for individual or $600 for the family. Out-of-state coverage, so Blue Cross does have a Blue Card program that covers for out-of-state coverage. If you have children, adult children that live out of state like I do, they can still have full insurance, same benefits that we have. If they're using out-of-state, they just need to be sure that they're billing Blue Cross Blue Shield of Oklahoma PPO. So instead of them billing Native Blue, they're going to bill the PPO, but that PPO pays just like our Native Blue does. We also offer out of country, which is our global core, and there is a web address there. If you're going to go out of country or you're traveling abroad, you're still covered. One of the biggest things that we wanted to talk about regarding the Blue Cross plan is that for emergency room services, it does have to be a true emergency in order to have it covered at 100%. And it can be an out-of-network provider or in-network. As long as it is a true emergency, it is covered at 100%. Ambulance services, in-network is covered at 100%. If it is an out-of-network ambulance provider, it is covered at 100% of the allowable charges. Unfortunately, most ambulance providers are out of network, meaning if you use an ambulance provider, it is very highly likely that you will receive a bill. We do have programs that we can refer you to help you offset some of the cost of those bills. Our Blue Cross Native Blue does have Muscogee Nation hospitals and clinics. Those hospital and clinics are available to Native employees only. Non-Native employees are able to use the employee clinic, which is located in Mulcogee, across from the medical center behind the Mulcogee clinic. The employee clinic does have new hours, so it is open from 7 a.m. to 7 p.m. and it is now open on Saturdays and Sundays from 9 a.m. to 5 p.m. That employee clinic, any of your dependents that are covered under your Blue Cross plan are also able to be seen at the employee clinic. Council Oak is also another facility that's owned by Muscogee Creek Nation where you can be seen at whether you're native or non-native. Here is the app for Blue Cross Blue Shield. I highly recommend the app. If you want to use the app, you would text BCBSOK. Actually, you're going to text BCBSOK app to 33633 to get the app. The app is, you can use the app to find an in-network provider, to access claims, to view your ID card. My out-of-state children, they use the app. That's how they locate providers in their area that are within our network. We also have BAM, which is Blue Access for members. This is for those of us that prefer to use, to go online to view our Blue Cross stuff. And again, here is the Global Core. So here's the web address if you're wanting to look up the information on Global Core. Our Blue Cross Native Blue Dental Plan, it is just $25 for the deductible, and that is per person per basic dental. Your deductible covers your, actually deductible does not apply to diagnostic or preventive services. But your dental benefits are, nothing has changed on those. You are allowed up to $3,000 per benefit period per covered person. That's for your diagnostic and preventative. There is also a $3,000 per lifetime for orthodontic services, so for those braces. The Native Blue Vision Plan, your eye exam is covered at 100%. Your frames are covered at 100%, up to $150, and contact lenses are covered up to $150. One of the unique things about the Native Blue Vision Plan is that you can get glasses and contact lenses. Both of those are covered under your plan. When you go to the vision, to the eye doctor, you do want to make sure that you tell them that your vision benefits are embedded into your medical. So when you go to the eye doctor for vision care, you're going to give them your medical card. If they try to tell you that they're not finding your benefits, just let them know it's embedded into the medical. For Native Blue prescription coverage, Prime Therapeutics is the pharmacy benefit manager for Native Blue. There are several pharmacies located throughout, I believe Walgreens and Walmart being two of the biggest ones where you can use your Prime Therapeutic benefits. Here's the cost of coverage for Prime Therapeutics. But we do want to also let you all know that Muscogee Creek Nation has its own pharmacy. It is called the Riverwalk Muscogee Nation. So here's the phone number. If you need to transfer your prescription from wherever you have it, if it's Walgreens, Walmart, wherever, you can call this number, talk to Clint, who is our pharmacist, and he will transfer it over. The benefit of using the Riverwalk rather than one of the Prime Therapeutic pharmacies is that there is no copay. So there's zero employee cost if you go to Prime Therapeutics. Our Blue Cross enrollment form, the things that we want you to know on the enrollment form. On this top section, just check the box, open enrollment. Fill out section 2. On section 2, we don't necessarily need your job title or your employment start date. We already have that information. If you're requesting employee only, just check the box employee only. If you have employee child, employee spouse, or family, go ahead and check the box family. And then fill out your eligible dependents information. Again, keep in mind if you're adding a spouse, we do need a copy of the marriage certificate or the common law affidavit. If you're adding children, we need copies of the birth certificates or the guardianship paperwork or adoption forms. Section 5, disabled dependent. This is if you have an adult child that is disabled. One of the things that Native Blue does is that it allows you to continue coverage on your adult children if they are disabled. We do have a disabled dependent form that you would take to your child's primary care physician. They would fill it out, you would return it to us, we'd get it over to Blue Cross, and then you'd be able to continue to cover that adult child. Page 2, we don't need any of this top information, so section 6, 7, and 8, we don't need that information, especially if you were already covered under Blue Cross, it's not necessary. Section 9, we only need filled out if you're declining coverage, and then we do need your signature at the bottom of the page, so sign it and date it. For Hartford, on our Hartford, so this is our basic life, supplemental, basic accidental death and dismemberment. In order to add a spouse to your Hartford plan, we do need a copy of that marriage certificate or your common law affidavit. And if you're adding dependents to your Hartford, again, we'll need copies of those birth certificates or court documents showing that they are your dependent. If you've submitted these documents for Blue Cross because you have added a spouse or children to your Blue Cross, we don't need them again. We only need them one time. Under Hartford Employee Basic Life, every employee is covered at 2 times their annual salary up to a maximum of $100,000. That's something that is paid for by the nation. It shows on your paycheck stub as GTL. So if you've ever wondered what that GTL is, it means group term life, and that is something that the nation is paying for you. We do offer dependent basic life. It's 69 cents per pay period, never goes up or down, and what it is, it's $5,000 life insurance policy on your spouse and $1,000 per child. Employee supplemental life. So if you're wanting to add some additional life insurance on yourself, in addition to what the nation is covering you at, you can request anywhere from $10,000 to $5,000. This year is actually a true open enrollment year, meaning you do have to enroll into your benefits. If you don't, you have no benefits. But one of the advantages of having a true open enrollment year is that this year you can elect up to $300,000 in life insurance coverage and not have to fill out an evidence of insurability. Normally during open enrollment you can only go up by $10,000. If you go over $10,000 you would need an evidence of insurability, and that is this big long questionnaire that you have to fill out. It gets submitted over to Hartford. Their underwriting team looks at it, says yes, this person is insurable, or no, they're not insurable. This year, because it's true open enrollment, you don't have to do that. You can elect up to that $300,000, no questions asked. If you want to elect more than $300,000, because an employee can go up to $500,000 of insurance on themselves, so if you want to elect anywhere from $300,000 to the $500,000, we do need that evidence of insurability. And the way that works is that you'll fill out the evidence of insurability. We'll start deducting your premiums at that $300,000 cost. We'll wait for Hartford to return to us, say yes, you're insurable, or no. If they say yes, then we'll go ahead and change your premium to whatever you elected. If they say no, we're going to just leave you at that $300,000. Some of the other things that Hartford has is we do have employee AD&D, so that's accidental death and dismemberment. You can elect up to $500,000 on that. Part of the cost of that is like If you elect $10,000 in coverage, it would cost you 16 cents per pay period. That's for employee only. If you elected 10,000 in coverage or employee family, it would be 26 cents per pay period. Children's supplemental term life is $10,000. If you elect supplemental term life for your child, you do have to select at least $10,000 of supplemental life on yourself. Spouse partner supplemental term life. You can elect to cover your spouse at up to $100,000. If you select to cover your spouse, you have to cover yourself as well. So if you select like $50,000 on your spouse, you have to do at least $50,000 on yourself. The thing about the supplemental term life on yourself as well as your spouse, when you reach the age of 70, there is an age reduction as well as a premium reduction. So meaning if you have $100,000 of life coverage on yourself, when you turn 70, that life coverage reduces down to $50,000. One of the unique things about Hartford, and one of the reasons why we keep using Hartford, is because unlike other insurance companies, when they reduce your premium, they don't charge you at that higher premium rate. So once it reduces at 70, instead of you paying for $100,000, you're going to pay for the $50,000. So they're not going to charge you for something that you're not paying for or for something that you're not getting. If you're wanting, when you turn 70, if you're wanting to keep that $100,000 in insurance, you would have to elect $200,000, and then that would keep you at that $100,000 level. Hartford short-term disability. So short-term disability is another one of those benefits that the nation pays for you. Everybody gets short-term disability. The biggest thing that we want to make sure employees are aware of with the short-term disability is if you need to use or file a short-term disability claim, you must utilize all of your sick leave before starting that claim. What happens is if you still have sick leave when you file a short-term disability claim and we pay you out at the nation on your sick leave and you get a check from Hartford, Hartford will send you a letter and say that they want their money back. We never want Hartford to do that to you all because you're already out on sick leave. It's an added stress that you don't need to deal with. Long-term disability. So with this being a true open enrollment year, long-term disability is something that you can elect into this year without having to do that evidence of insurability. Normally, to get long-term disability, you have to fill out that evidence of insurability. This year, it's not required. So even if you have tried to elect long-term disability in the past and were denied, you can do it this year, no questions asked. Your long-term disability generally kicks in after your short-term disability. It also pays a little bit more than your short-term disability, where short-term disability is only half of your paycheck, up to $575 a week. Your long-term disability is 60% of your salary, up to $6,000 per month. There is a formula for the long-term disability. This is the formula. However, if you're wanting to elect it, we can help you figure out the cost of that, or you can follow the formula. Some of the miscellaneous benefits that we wanted to make sure employees were aware of that Hartford offers is estate guidance and will services. You can get free power of attorney. They do help you with funeral arrangements and living wills at a small cost. There's also ability assist counseling services. You can get up to 3 face-to-face visits per occurrence per year and unlimited phone consults. Here's the phone number for the beneficiary. There's also beneficiary assist counseling services, and these services help you cope with emotional, financial, and legal issues after the loss of a loved one. They have a health champion, so if you just need to speak to a nurse and just ask a simple question to a nurse, that is something that you are able to do as well. They also help with travel assistance, identity theft protection. Employees, so one of the other things that the nation has that our employees are not aware of is that there is an employee assistance program. Under the employee assistance program, you can get help with emotional or work-life counseling. They can help with stress and anxiety. They can help with substance abuse, school disagreements. Some of the other things that are offered is they can help you with how to manage a budget, tax questions, saving for college, retirement, can help you with getting out of debt. There's also legal support regarding bankruptcy, divorce, power of attorney, how to buy a home. There's a whole plethora of things that you can do with your employee assistance program. On our Hartford enrollment form, it is 4 pages. We do need all 4 pages filled out in their entirety. On the top section, your employee information, this part with your job title, your date of hire, your salary, the class, location, and division, that part you can leave blank. We do need your smoker status. You do have to have been nicotine-free for at least 12 months before you can have a non-smoker status. Again, with the Hartford, if you're adding a spouse or children, for the spouse we need copies of that marriage license or common law affidavit. To add the children, we need those birth certificates. If you've submitted those for Blue Cross, we don't need them again. Your short-term disability, this box to elect coverage should be checked because this is something that is paid for by the employer. So you can't really decline it. It's not a cost to you. Top of page 2 is the voluntary long-term disability insurance. If you do want to do the long-term disability, you're going to check this box. If you're not sure what the price is, you can leave it blank and we'll fill it in for you. If you want to know what the cost is, just contact benefits. We'll help you figure out that cost. If you don't want it, please check the box decline coverage. On our basic term life, every employee again is covered at that 2 times annual salary up to $100,000. So that is paid for by the employer, so that box should be checked. If you want the additional $5,000 of life on your spouse and $1,000 for each child, then you will select elect coverage. If you don't want it, please check the box decline coverage. Supplemental term life insurance, you can elect up to $300,000 without having to do the evidence of insurability. If you want to do more than that, then we need that evidence of insurability. You would just see one of your human resource representatives and we'll give you that evidence of insurability to fill out. If you don't want additional coverage, then just check the box decline. Top of page 3 is the spouse partner. You can elect up to $100,000 on your spouse. And again, if you elect coverage on your spouse, you do have to elect the same or higher for yourself. If you don't have a spouse or don't want coverage for your spouse, please check the box decline. And then also for the children one, you can do $10,000 on your children. And again, if you want to cover your child at $10,000, you do have to elect at least $10,000 on yourself. If you don't have children or you don't want to cover the children, just check the box decline. Voluntary accidental death and dismemberment on this one. This is the one where employee only, if you were going to do $100,000 at employee only, it would cost you, I believe, 26 cents. Actually, it's 10,000 would cost you 26 cents. 10,000 for employee family would cost you, I don't have my cheat sheet. It's a relatively low amount. But if you want it, you're going to either check employee only or employee family. We can help you figure out the cost of that. If you don't want it, just check the box decline coverage. Page 4, we do need page 4 filled out. This is your beneficiary information. So even if you declined all of the supplemental coverage, we do still need the beneficiary page filled out because the nation does cover you with life insurance as well as that accidental death and dismemberment. So if something were to happen to you, we need to know who to give your money to. When you fill out your beneficiary information, it does need to equal 100%. So if you have 3 primary beneficiaries, you need to give one person 34%, and then the other 2 would be at 33%. And then we ask that you sign and date the bottom. This page, we just ask that you read it. So our Bank of Oklahoma, this is our 401k plan. Every employee gets 5% profit share. So the nation contributes 5% right off the top into your 401k, whether you contribute or not. You can contribute anywhere from 1% to 100% into your 401k. The nation will match that at 4%. So if you contribute 2%, the nation matches 2%. If you contribute 4%, the nation will match 4%. If you contribute 6%, the nation is only going to match that 4%. And you can contribute up to $22,500 per year. If you were 50 years and older, you can contribute an additional $7,500. To do your catch-up contributions, you would just elect at a higher amount. This is your vesting schedule for your 401k, and it's in regards to what the nation puts into it. So it's your profit share as well as what the nation is matching. One of the things that we wanted to say regarding the 401k plan is that it is not a savings account. It's a retirement account. Because it's a retirement account, there are limited ways to get that money out of your retirement account. You can take out a loan on it, which you would have to pay back. There is a hardship hardship withdrawal. With a hardship withdrawal, it does need to be a true hardship, like maybe your house is in foreclosure or you're facing eviction. There's an in-service withdrawal. In-service withdrawal, you do need to be 59 and a half years old in order to do an in-service withdrawal, or separation from employment. On your 401k form, we do need this top part filled out. And then if you do want to contribute into your 401k, you're going to check the box yes. If you only want to do 3% into it, you'll check this top box. If you want to do anything above 3%, check the bottom box. If you want to just leave it at what you already have it at, check this bottom box, leave the election portion blank, and write no changes out to the side over here. If you do not wish to contribute into your 401k, go ahead and check the box no here. That says that you don't want it to make any deferrals at this time. If you don't want to, so if you're over the age of 50 and you don't want to do any catch-up contributions, check this box here that says I do not wish to contribute any additional. And then sign at the bottom. Let me see if I can make that go away. No, I can't. Yes, I can. Sorry. So, and then sign here at the bottom. On the beneficiary form, one of the things that we need everyone to know is that if you are married, your spouse is your primary beneficiary on your 401k. If you do not wish to name your spouse as your primary beneficiary, and let me rephrase that, your spouse is 100% your primary beneficiary on your 401k. So you can't name your spouse 50% and maybe one of your children 50%. They have to be 100%. If you want someone other than your spouse as your primary beneficiary, we do need this page filled out, and it does have to be notarized, and we have to have your spouse's signature. If you're not married, then you can put whomever you want to as your primary beneficiary. We just ask again that your beneficiaries equal up to 100%. On this page, we do need you to fill out the very bottom portion where it has participant name. So this is your name, your signature, your social, and the date, whatever date you filled this out. And then, yes, of course, you're going to check one of these up here. We do offer AFLAC, which is a pre-tax benefit. If you're at one of our open enrollment meetings, you'll either have Kelly or Tammy who will give you more details on what these AFLAC benefits are. We also offer MetLife or MetLaw. This is our legal plan where we have 17,500 attorneys that are available to you that you can speak with either face-to-face, by phone, email, or online. It does offer legal representation on some covered services. For employees, you will pay an attorney fee on non-covered services, but on the covered services, there would be no attorney fee because you're already paying it. It's $9.75 per month, just bi-monthly, I'm sorry. So on those months where there's 3 paychecks, this will come out of your paycheck only twice. Some of the things that are covered under the MetLaw legal plan are boundary and title disputes. They can help you with mortgages. They can help you with property tax assessments. They can do complex wills, powers of attorney. There's juvenile court defense. There's name change, parental responsibility matters. They can help with those adoptions. They can also help with civil litigation services, incompetency defense. There's just a whole list of things that are covered by our MetLaw plan. And so on the MetLaw, if you want to select it, you're going to check the box that you want it. If you don't want the MetLaw, then check the box decline. If you have one of those MetLaw forms that doesn't offer you the option to check the box decline, then just write on here somewhere decline. Sick leave donation. We wanted to make sure that all of our employees are aware of the sick leave donation. In order to, what it is that if you donate at least 8 hours of sick leave into this sick leave pool in October, it allows you to be able to request up to 240 hours of sick leave at a later time. So say that you have an illness or an injury that is going to require you to be out of work for 3 months and you only have 40 hours of sick leave. You can use your 40 hours of sick leave and then you can request up to 240 hours of additional sick leave so that you don't go leave without pay. We never want our employees to go leave without pay. We want you, like if you're sick or injured, we want you to be able to be at home and to heal without having to worry about how you're going to pay your bills. So again, with the donated sick leave, you just donate at least 8 hours of sick leave in October. You do have to donate every year. You do have to be employed with the nation for at least 1 year, and you do have to file for your, or request for your FML. Workers' compensation. If you have an accident at work or an incident at work, please let us know immediately. I do want to say, unfortunately, our e-forms are not working properly at the time, so if possible, download and print those forms, keep them readily accessible, take a picture of it if you have an accident, and email it over to the benefits office. When we get that accident incident report, that cues us to submit, to send you the workers' comp claim forms. With workers' comp, you only have 10 days to submit your workers' comp claim. And with that actually it says, yeah, you have 10 calendar days to submit your claim. You have 14 days to seek treatment on that claim. With your workers' comp claim, you need to make sure that it comes over to the Human Resources Benefits Office because we do need to sign off on it. So when you receive the workers' comp claim paperwork from us, be sure that you return it to Tribal Human Resources, not to Tribal First. So don't send your workers' comp claim over to Tribal First yourself. It needs to come to HR first. If you send it to Tribal First directly, they'll say that they don't have it. It has to have our signature on it. Workers' comp benefits for light horse officers, they're covered from the time they enter their patrol car. If there is an automotive accident, it requires a drug and alcohol test, no exceptions. Volunteering to work at an MCN event must be documented. So you have to be on a roster in order to be covered. If you're a participant at an event, then your workers' comp claim is not covered. So the required forms for open enrollment are your Blue Cross Blue Shield enrollment form, your Hartford enrollment form, beneficiary information is required, your MetLaw enroll or decline, AFLAC change it or decline it, your 401k enrollment form is optional, but your 401k beneficiary form is required. Here is the link for our e-forms. Again, our e-forms are not working properly, so if you click on the link, we just ask that you download the PDF version, print it, and bring it with you to open enrollment. Supporting documents for Blue Cross and Blue Shield must be submitted along with your enrollment form. So again, those supporting documents are your marriage license or common law affidavit, and birth certificates, guardianship forms, or adoption forms for children. Thank you.